Munir, who is a molecular virologist at Lancaster University and joins me now live. Mohammed, thank you very much indeed. How dangerous is the potential spread of Marburg? How transmissible is this?
Well, Marburg is very closely related to Ebola-like viruses, and those are not respiratory in origin. They are relatively rare and very difficult to transmit from one person to another person because the means of transmission is usually through the exudate, through the bodily fluids. That is, for example, vomiting with blood or the blood secretions or cut onto the skin or contaminated needles and so on. So therefore, the transmission is relatively rare. However, the issue is that these diseases are very lethal. There's more than 80 people out of 100 infected can die. That is really the major problem. But the transmission compared to, for example, influenza and SARS-2 is not really that easy.
And is there a profile of person who's more affected by it? Clearly, when we were dealing with coronavirus, people who had respiratory problems or indeed were older tended to be more vulnerable.
Yeah, well, that's a very important question. The thing is that the Marburg and the Ebola viruses haven't been into the population at a very wider scale. So therefore, the predisposition factors or the vulnerabilities are not really clearly defined. However, what we do know is that Ebola virus and the Marburg, because they both belong to the same family, they have a high tendency to stay dormant within a person that is infected, which means that people who are having immunosuppression, elderly age, or under some treatments like, for example, oncotherapy, and the treatment for the cancer, those people are very likely to harbor the infection and would have severe consequences because of the wear and tear over the treatment or over the age.
And how much research and development goes into trying to find a vaccine for Marburg or indeed Ebola? Because I know, coming back to coronavirus, when that spread around the world, a vaccine was developed very quickly indeed. And if the right minds got together, surely a vaccine for Ebola could be developed.
Yes, absolutely. Ebola has two different parts. So it is one virus is very common, for which we have approved vaccine. For another type of the Ebola virus that is not very common, but it is emerging again, we don't have the vaccine. But for Marburg, we don't have the vaccine that has been even into the human trial. However, the efforts are being made to develop the vaccine for Marburg, because Marburg, as you were saying, is not new virus. I mean, it's around 40 years old virus, but the overall spread of this virus hasn't been that much. So therefore, there was no need to develop a vaccine because that was not felt for that. However, the technologies are there. The technologies, those been very successful for COVID-19 vaccines, those can easily be repurposed for the vaccines for hemorrhagic fever viruses, including Ebola and Marburg. So the efforts are already ongoing. I think there is one vaccine that is already been into the human for phase 1 trial through the WHO. So the vaccines for the Ebola virus as well as Marburgs now are the necessity and will be developed on priority basis.
Great stuff, Mohammed. Thank you very much for putting us in the picture there. Mohammed Munir from Lancaster University.
Thanks for having me.